Well, hello, everyone. Welcome to the King County Continuum of Care Board Special Meeting. Today is Thursday, October 19th. It is now noon. Why don't we start with a roll call?
Yep. Okay, got it. If you're present, please say present. Patricia Barnes, Sam. Tamara Bauman.
Here.
Kenyatta Carol Hillman. Lise Castro. Jaja Floyd. Marvin Cottrell.
Present?
Antoinette Lambert. Dorsal Plants.
Present.
Ruby Romero.
Here.
Martha Sassarosi. Christina Selwicki. Sherry Tillman. Galena White.
Yes.
Awesome. We have 5 members present. Quorum is not.
Thank you. Please let me know when we do. Tamara, would you like to give us a quick land acknowledgement? That's I can't hear you. Still muted.
I am so sorry. I was not prepared for this. It's been kind of a crazy morning and day and week so far. So I apologize.
No worries. Anyone else like to do a land acknowledgement? Righty. I will give a brief one. I'd like to take note that we sit on the land of the original Duwamish peoples. And this county sits on the land of 21 tribes of Colas Salish people. And when we can reconcile that original displacement, I believe we will make inroads to housing all of our community. Should not be ignored, and it helps guide our work. Thank you. So our special meeting today is called so that we can get a presentation of the point in time count that's upcoming for 2024. Owen has joined us today to lead that discussion. And I would like to note before he starts, if we have anybody in the gallery, public comment is always accepted throughout our Continuum of Care meetings. Please notify us if you have a question or a comment, and we will give time to take it. Thank you. Owen?
Excellent. And just want to note for Alex, it looks like we have a few more members who have joined, if you would like to acknowledge them first.
Yes, I see Sherry Tillman is present. And okay.
And Patricia?
Patricia?
Yep.
Yay, everybody's here. Okay, almost. Let's see. We have 8 members present. We do have quorum.
Excellent. All right. We won't, just as I pull up my deck, we are not going to be doing any vote on the point in time count. The purpose of today is really to inform you and keep you all up to date as we develop on this planning and make sure you have a venue with which to ask questions. I appreciate you all making the opportunity for me to come in a special meeting for this, since I was ended up out sick on the day that I was supposed to do this. So let's get started.
And I see Christina to join us.
Oh,
Welcome,
fantastic.
Christina.
Fantastic. Okay, you would think after all these years of being remote that I would be used to presenting in Zoom, but not. So apologies if I fumble through just a little bit at the beginning. So like I said, here to talk about the 2024 unsheltered pit. We'll go through quite a bit of detail today on that. I want to make sure there's a chance to answer questions. Before jumping into the pit, though, I want to remind folks that our North Star at the KCRHA and as a region is the total number of people experiencing homelessness. When we did our 5-year plan modeling, we found that in 2022, using administrative data alone, we were able to find that 53,532 people experienced homelessness at some point in 2022. That number is much larger than what we've normally talked about as a community, and that is the number that we will continue to be dedicated to. Our modeling shows a growth of that number over time, and so we will keep that updated as we move forward. I also want to recognize that this is probably a new floor, not a new ceiling. What I mean by that is that there's people who are not touching some of these services who are not included in this count. This is a new floor, a minimum number of people who experienced homelessness that year, just in King County. I say that because we need to make sure that as we do this work, that we're planning for every single one of these individuals. When we move towards talking about the point in time count, which is a very important exercise, and the number that comes out of that is extremely valuable, we'll just continuously reference back to this as an agency and when I speak in front of folks. Right, now for the agenda. So I'm going to give a little bit of background on the point in time count. We'll talk a bit about the overview of what we're planning for 2024. The main piece of that is going to be getting into some of our methodology around response-driven sampling. This is the same methodology we used in 2022 and want to acknowledge some of the, though not exhaustive list, but some of the lessons we learned in 2022 and give a high-level timeline of what is going to take us from here to the count and submission. Background. As I believe you all know, the point in time count is required by HUD, the United States Department of Housing and Urban Development. This takes place at the same time as another count, the housing inventory count, which is an indexing of all of the temporary and permanent housing units in the homeless service system. While the sheltered pit, which is a count of people in those locations, and the HIC, the housing inventory count, happen every year, the unsheltered pit is only required every other year. Since the RHA took over administration of the system, because we have those larger numbers I mentioned earlier, we have moved from doing it every year, which was done previously in the community, to every other year. The standard unsheltered pit is a street count. That's something that King County actually pioneered and is what has been adopted largely across the nation. This is a great way to... Marvin, would you mind muting? I'm getting some background noise.
Yes.
Thank you. Mostly I can hear myself talk back. And like, I hate hearing myself talk in public speaking. We know that this is an undercount. This is widely understood, both locally and nationally. And so HUD is actually encouraging of folks who are looking for different ways to do this count that may be more accurate. Again, I want to recognize that King County has been doing the point in time count long before the KCRHA was even an idea in anybody's mind. People who have done this before are Skitch, leading it for a very long time. We had All Home leading it at a period. But in 2022, when the KCRHA officially became the system administrator, we took over the count. At that time, and I just like don't want to like reconstruct history here. At that time, we didn't think we had to do the unsheltered count in 2022. I think we all remember that this was a little bit rushed. We had anticipated per what HUD's guidelines have always said that the unsheltered count is only required in odd years. 2022 is an even year, so we did not think it was required. And as we made that announcement publicly, HUD said that it was required. So in that conversation, we immediately started working with folks at HUD in order to get a methods exception. That was the genesis of finding this new methodology, because it was something that we could do within the time period that was scientific and used and validated by other social or other human services work, particularly in the public health sphere. And so in 2022, because of great partnership with folks, including the LEC, other folks with lived experience, and some researchers from the University of Washington, we were able to pilot respondent-driven sampling as a way to do a new version of a count. So 2024, the big question is, where is this at planning-wise? Planning is well underway. I've been in conversations with folks at HUD since July about the methods exception. And we are on track to get that methods exception this month. It is what sets the way for respondent-driven sampling to be what we do here. Very, very confident that we will be getting that. When talking with folks that had, particularly with William Snow, he was asking for more information from us so that he could share it with other communities who are actually interested in learning from this. So this method, again, is an opportunity for King County to maintain at the forefront of what it means to do quality counts and engagements, similarly to when we started the point in time count long ago. A key part of this is looking back at what did we do in 2022, what did we do right, and what did we do that needs a little bit of fixing so that we can really learn from that. I'll talk more in detail about some of those lessons learned later in this. And then we're also partnering again with some folks at the University of Washington. Those were the folks who helped us in 2022 with realizing the methodology of respondent-driven sampling. And they've been working over the course of this year to actually refine that approach, align it even more with other best practices of respondent-driven sampling from folks like the World Health Organization, National Institutes of Health, and others, in order to improve upon what we did. Really excited to be partnering with them because it means that we're not only learning from our lessons in 2022, but we can make some significant improvements based off of what they learned as well. I want to be really clear with folks that as we work with the University of Washington, we will have a data sharing agreement that's pretty locked down. They do not need access to any information in HMIS. So I just want to be really clear with folks about that it's not, it will not be elucidating any records from HMIS to them. This is really a data sharing agreement about the data that we collect during the pit, both in the sheltered and unsheltered pit, which I will remind folks is anonymous data, but we are still going to lock it down through a data sharing agreement. We'll also be working with them to ensure that we have research oversight. So we will be submitting a final methodology to the Institutional Review Board at the University of Washington when that is ready. If for whatever reason, the University of Washington says that it does not fall under their purview, we do have a plan with which to get it from the state's IRB. Costs a little bit of money for us to do that, but we're pretty dedicated to ensuring that this has that oversight. That oversight is not a requirement, just want to share with folks, but we are trying to increase the community credibility of this so that people don't poke holes in it. And it was a pretty clear call from folks last time that we did this call that was an oversight by not doing it. So want to be responsive to that community and build trust in this approach. So what is respondent-driven sampling? To move something. Respondent-driven sampling is a sampling strategy and a set of statistical estimators. We'll talk about the statistical estimators in a moment. It is specifically designed to measure hard to reach populations. So people experiencing homelessness are a hard to reach population because they can be anywhere outside, particularly in the rural parts of our community, which I will remind folks that King County landmass wise is actually largely rural, majoritively rural. People are living in places that we would never go in a one-night count. So this is really about helping to get to those hard to reach populations and making sure it's representative of folks who would never be included otherwise. Some key features of this, it doesn't require sampling frame. What I mean by that is usually when we do like population level statistics, we identify like a full frame of what we're doing. We take a small percentage of that and then we do some math with it. And the way you create that frame often is by addresses. So you identify who is the whole population we're talking about, where are they, and then how do we randomize against that sample? for people experiencing homelessness, that sampling frame doesn't exist. So this is really an amazing, and there's a couple other methodologies that you don't need a sampling frame for, but this is one that's really unique in our ability to do that, and makes it much more possible to do this with validity. It also allows participants to remain anonymous. This is true both in the previous methodologies and this methodology. A key part of this is it leverages peer recruitment. So part of this that is so beautiful about this is we can help remove some bias from the people who are surveying folks by making sure that the person experiencing homelessness is driving the recruitment of additional people that we work with. That removes a significant amount of researcher bias from this, which is one of the reasons that people use this frequently. It also allows us to directly survey the people who are in the sample. So in the one-night count, as many of you who have participated know, the actual enumeration of people is not the same as creating the survey, which is the information about demographics that we actually use in order to qualify who is within that population. What's really nice about this is we get to couple those things back together. So how we sample people and collecting their information happen at the same time. Okay, so that's really talking about like what it is in terms of why we're using it. I'll walk through this graphic in a moment to talk about like the how. Some other words that you may see from this is that it's linked trace sampling or network sampling. Network here being about social networks. And when I say social networks, it's person to person, not something like Twitter or Instagram. And the way that this works is we start with a seed, or we start by seeding a network. What does that mean? Seeding a network means that we go out and we identify somebody who is experiencing unsheltered homelessness, ask them to participate in this. They consent, we do the interview with them. And then the key part is that we give that person 3 coupons. Those coupons, it sounds weird calling them coupons. And every time I say it, I think it's a little bit strange, but we give them coupons that have information about where we are, where our hub is going to be, what we're trying to accomplish, and what kind of stipending they will get if they participate. That person then goes and talks to 3 people within their network who want to participate, give those coupons to that person, and those people then come to a central hub within a region. There, they get their interview completed or their survey completed. They get another packet of 3 coupons, and they go and give those out to 3 people within their network. And as you can see over on the right, that moves from a really small initial first couple waves to a huge amount of people that can come from just one seed that we do. That's the magic of this. Again, it is leveraging people's networks who are in the population to get both deep and wide within those networks. Through this process, the coupons also have a little code on them. That code helps us understand how individuals are connected so that we can actually map out all of this connection afterwards. That's the key here, is it helps us to understand how the network is connected. Okay, now some math. So as I said before, the respondent-driven sampling is both a sampling methodology, which is really what we've talked about so far, and then it's also a statistical estimator. So there's, I think I'm saying this right. I said this to Marvin the other day when we talked about it, that I never say this name right, and then I should have looked it up and I still didn't, but I believe it's the Selganic Heckathorn estimator. Is the estimator that folks use in to figure out what the population size is based off of this methodology. Essentially what this does is it is looking at the total number of the sheltered population, so average degree of that population. There's a couple other pieces within that we get from the actual sheltered point in time count, and looks at the average degree of unsheltered population. Through a comparison of those 2 components, as well as then looking at the cross-section of each group's relations, so looking at that network connection, we're able to get an observed proportion of that group. And it's looking again at that network component, the referrals component is what it's mentioning here that is really helpful. This allows us to then look at, again, including a couple additional components, allows us to get to a total population based off of this respondent-driven sampling. It does it not just for the overall population, but allows us to also then take those demographic cuts that we're talking about, the pieces that we submit to HUD. Christina.
Why aren't we doing it the old way where it was more inclusive? We got to a lot of different demographics that were just left out this last time, like those with Alzheimer's, the deaf-blind community, the deaf community. I can at least list 24 different communities that weren't interviewed in this last process. Why? And maybe I maybe one of the older, I meant those have been around long like me, could say why we left the last way we were doing it, like going on buses and counting and having people out in the community counting that one night. What happened with that approach?
Yeah, when the RHA took this over, and again in 2022, we were looking at ways to change something from being known to be an undercount and not fully representative to try to find better ways to do this that are aligned with statistical norms for enumeration within communities. It is by no means perfect, but it is something that is moving in the direction of actually increasing our total view of people experiencing homelessness. When we were looking at, when we did this in 2022, we actually saw one of the largest largest increases in the number of people experiencing unsheltered homelessness compared to previous counts. That to me tells me we're on the right track to getting to a better enumeration of this. So it is not perfect. We do need to work on how we include additional communities. I'll talk about that a little bit, but Christina would really love to work with you directly on how we include some of those other communities that you're talking about. Does that answer your question?
How do we account for this variability of losing population samples, like specific population samples, like the deaf-blind community, which was completely left out, or those with Alzheimer's that were completely left out? I can at least name 55 people with Alzheimer's or dementia that I have talked with in the last 2 weeks alone. And I can bet for sure that none of them were talked to because they're very difficult to discuss stuff with. It's harder to communicate, etc. But how are we accounting for those loss of that specificity in the sampling sizes of those demographics versus approaching people?
Yeah, I have two separate responses in there. First, I want to talk about the fact that you absolutely will talk to folks across the entire homelessness spectrum, regardless of their demographics, regardless of whether they are in one of those communities you mentioned, Christina, who were not actually interviewed. This sampling method is not about engaging with every person. This is a method that is really meant to take a sample, a subset of the total population, intentionally a smaller set of that, and then modeling to the larger population. So not everybody will get touched in this. And that's why, and we'll say that was like a hard thing for me to get over when I started talking about this. But I will also say that in the one night count, we're also not counting everybody. Not everybody is represented in that. We're counting the people that are visible within that. The second part to your question is how do we ensure that this is better, more inclusive of folks? That is something that we are still learning. We did engage with folks in 2022 and found, and I'll pull it up later and follow up with you over email because I don't want to accidentally misquote a number here, but I believe it was around 50% of people that we engaged in the count identified as having a disability. The level of detail that we report to HUD is that they don't collect any deeper information other than whether or not somebody has a disability within that. So it is not perfect. We do need to improve, and I want to work with you on how we improve that component of it. Does that answer your question, Christina? I imagine not satisfactorily.
It does, and it also goes to the question of like stuff like there was also when we did it the other way, there was more access to different variances in language, like having somebody who speaks Lingala or other language, Anit, or even something else besides sign language, like, you know, there's more than one different languages out there, like signing exact English, you have those people who go out in those communities versus, I don't know how many, but just say like 100 people, you don't have that also language variance, which King County prides itself in. How are we gonna account for that as well? Like, because there's so many languages and variances in that.
Absolutely. We are contracting with the language line as a resource with which to do live translation with folks. We're making sure at the very least that we also translate our written materials into Spanish, and we're working on getting those, when we do have those materials, we'll be working on translating them to others as well. So that's our current approach to it. What else would you suggest in there?
Well, I like and I'm going back to when we did it before, when everybody else did it before, you know, it was a community approach. So people like, I'm going to pick, you know, I'll pick the Ukrainian community. So we approached the Ukrainian community. We had a group of, you know, 3 or 4 sets of people who would go out in that community and would have that language and have that aspect of it. And we went across all the communities and really utilize them and that aspect of community versus one group that way. Does that make sense?
It does make sense. And this actually connects to a conversation that I've had with Marvin about how the point in time count in the past when we're doing it that way is also a community organizing event where we get a lot of people together and connected who aren't normally. And that is an absolute beauty of what that was. Marvin let me know previously that that's actually like one of the main purposes for how this began, and then it switched purposes to something different, which was the meeting the HUD requirement for enumeration. That is a piece that is missing here, but it's not the point of this. And I want to be really clear for folks that I don't want to do community engagement events towards something that we know is not real, is not a real number. So if we have a better methodology to get to that, I'd much rather use that better methodology and then use the engagement opportunity we have with folks to build community, to do those other components. And I actually really see this board through the COC convenings as a way that we can really capitalize on that. How do we use other opportunities to get people out, get people connected, and channel that energy into something that's beyond just a count in order to really make meaningful change? So it's not perfect. I don't have a substitute for that right now, but I think we need to find a substitute for that.
Lise has her hand up also.
Thank you. Please.
Hi. Yeah, I just want to say that Christina made really good points about people like, especially with like really specific marginalized.
How long have they been
Sorry, I'll wait.
unemployed without shelter?
Okay. But yeah, specifically people with marginalized, sorry, niche identities that like often like fall under the radar. I want to acknowledge that like snowball sampling, or I think you called it like seeding, is not what I would consider the best for that if we are hoping to get, because I know that you said overview, but whenever you like say like overview, then what we're going to get is the people who have the most access to things like this, which are likely not going to be the people like on the fringes who are most underserved. So yeah, specifically with disabilities, I want to acknowledge that PTSD is a significant disability, and I do not know a single person who has experienced homelessness and not came out of it with PTSD. I believe that everybody who has experienced homelessness could identify as disabled on a piece of paper if they chose to. And I do not feel like the disability question gets to the point of these identities, such as being deaf or blind, that Christina is raising. So yeah, I really appreciate Christina raising that. And I also would definitely encourage more targeted outreach. I know that you said that you started with like a certain number of people and gave them all a few coupons to pass on to people of their choosing. I think if we were more intentional about making sure that we started with just like really underrepresented groups, then then the sample size we would get beyond that would be more just like vaguely representative of the overall system. But I appreciate the work that you're doing. Thank you.
Thank you. Appreciate that. And like in hearing that call. So appreciate this input on it. And again, would really love to work with you all, particularly Christina, you being a regular advocate for the communities you're talking about how we can do that seating more appropriately. How do we make this more inclusive? This is one of the reasons why I'm wanting
And
to
can
bring
I say one other thing?
Oh, yeah.
I also liked when we had people riding the buses and the light rail to ask the questions too more frequently, because, you know, it seems like sometimes some of the other places that, you know, especially I'm going to bring up my veterans, you know, my veterans, as she mentions PTSD, don't a lot of times go to some of these community kitchens, other group areas, because they can't be by somebody else or, you know, other reasons. So you see people on buses that are sitting there by themselves or lighting the light rail, etc. And having more of that approach to getting those type of samples as well. I rode with the last, before you guys got there, Transit Riders Union. That's all we did is we went out on the transit system and we interviewed people day and you know that night on all the transit sources, and we got a lot of interviews on those transit pieces by people who are just riding because it's cold, etc. And that was something I wish we could also bring back in the context and how we do it, because I think it was very valuable.
Yeah, thank you.
And if it had, real quickly on, one of the things that we talked about is that we haven't fully laid out what hubs are going to be and what they're going to look like. And we're collecting a lot of good information about how we establish what is a hub. Could it be Metro? Could it be folks? I mean, there's still more work to this being developed. If we get the full presentation, well, maybe then we can set a little time right following this to capture all of these questions that need to be asked and get back and come back to us, you know, at our next regular monthly meeting, which will only be a couple weeks away. So folks might get more, get some of the answers from the questions that I've heard been writing down. Christina, Ruby had her hand up, and then Christina, if your hand's still up, I'd like to call on both.
Sure.
Ruby?
Thanks for making time today, Owen. I appreciate the presentation a lot. I just wanted to quickly highlight both comments that were just made and maybe make a suggestion of, you know, somehow making a person the hub, if it's possible, you know, like if somebody feels comfortable, you know, such as specific communities, somebody feels comfortable to volunteer, like to go into a specific community, they could possibly be designated a hub. I don't know how we could do that, but also have set up hubs as well. That seems to be kind of a combo. I don't know if we can really work that into it this late, but that's just an idea I had.
Thanks, Ruby.
And yeah, thank you.
Thanks, Ruby. A person as a hub, unfortunately, is not a way that we can do this. But to Marvin's point, I do want to figure out like hubs are not set. And in a moment when I talk lessons learned, there's going to be a couple parts about communities that we're working with to improve. And one of those, I think, is going to be a really interesting way to be looking at this that I want to share with you all. But and it gets into like a non-physical hub. Ruby is why I'm giving a little preview of it.
Okay, cool, thanks. I guess a follow-up question would be, are we allowed to like go out in the community and bring people to a hub, or is that not allowed? I would understand if it's not, so thank you.
No, for this to work, there is a part of that. So like in seeding, we're going to do seeds. And so part of that can be like identifying the first people to be a part of that. And then, great. So like, this is not, the choosing of who those first people are is not something that just be really clear, not something I'm qualified to do. It is something that we need to do as a community together. And it needs to be folks who, when we are in those hub locations, have an understanding of folks who are there and have relationships with folks. So it's not, this is a bit of a change from what we did In 2022, one of the things we learned is we worked with folks who were working with us hand in hand from the Lived Experience Coalition to find people who were close to the hubs we were working at and to do seeds directly with them. It was
Oh, okay.
not as direct, it was not as intentional of approach as what we plan on doing this year or what you all are asking for right now. So we will, when I talk about some of the lessons learned, I'll highlight some of those pieces.
Great, thank you.
Christina, I see your hand still up. I'm gonna move on, but Christina, if you have a question, please let me know. Okay, some of the lessons learned. Again, non-exhaustive list, but some key ones that we're lifting up. Immediately when we were in the field last year at Burien and Auburn, we were hearing from folks that those were not the best representative locations in South King County, and it was suggested that instead we go to Kenton Federal Way. We couldn't change mid-course then, but we are looking at how we can change that for the upcoming one. That's not to say that we won't have a hub in Auburn and Burien. There's a chance we will be doing one in Auburn, particularly to ensure that we have a good representation of youth and young adults in this work. We have a partner there that is really eager to support that. So none of those decisions have been made yet, but this is what our current thinking is. We also recognize that only having one rural hub in North Bend was difficult for some folks to get to. Well, we did get and I want to be clear, we got a good amount of people coming to that hub, but since our rural community is so spread out, we're looking at adding an additional rural hub. We don't know where that location is. Very open to input on that now or later, but making sure that we can get some better representation there. I sidebar on this real quick. I staffed the North Hub with some folks last year, and it was amazing to have people who let me know that they had never heard about the point in time count, never been involved with it, had been living in the woods for years, did not have access to services. I talked with a few veterans who had been living out in the woods there for 5+ years, who had significant disabilities. And because of that, we're not able to navigate to other services. So I was able to get a lot of really good stories with people and a lot of really great time sitting down and talking with them. But that is one of the magics of the hub, is we do talk to people who would never be included otherwise. One of the things we also learned, and Marvin knows this quite well, staffing demands are much greater than what we had originally anticipated. I believe Marvin was on the phone with my predecessor, Daniil, and Janelle, and I think Daniel, who was with the LEC at the time, was on the phone almost nonstop trying to get more people who could come in and support these hubs. We've learned a lot more about what it takes to staff them, what the different roles need to be, and how we can make it as seamless of an experience for people who are coming to be interviewed. And so we'll have a more robust staffing plan and clearer roles. Right now we're identifying like what are all of the key roles we need per site, what are the key roles we need at, back at the office to be on support, and what's the right number of folks we need for those. So we will be recruiting for a larger number of people quite a bit further up in the timeline. Excuse me. We also did a lot of this on paper last time, and it required a lot of physical management of small objects and a lot of handwriting of different pieces. That became pretty hard to manage at large scale when we had tens of people coming through a site at any given time. And it also made it so that we had a lot of hand data entry that needed to happen back at the RHA every night, and a lot of validation on top of that. What we're doing this time is we're actually going to be using tablets in the field with surveyors. One of the key pieces here is that with them being on a tablet, I'm working with our comms team about what kind of direct text translation there can be on those tablets at that time to make it more accessible. And surveyors will be there working with folks to complete that survey. This also helps us to do some coupon tracking more directly, and rather than relying on people to write down what was then, I think, like a 4-digit, the system I made last year was not the most user-friendly. People had to write like 5 4-digit codes every time they interviewed somebody. It worked out, but we're going to simplify that this year by actually having something that prints the coupon codes as we go. Some other lessons learned. We know that we didn't represent everybody correctly. One of the key pieces that we learned early on is that our American Indian and Alaska Native community was underrepresented. And this, in conversations with Chief Seattle Club, seems to be maybe not that we did not actually have a large portion of people who identify as American Indian, Alaska Native in our sample, but that the way we collected the race information by being a select all that apply ended up putting a lot of people who would normally identify within that community into a mixed race category when we reported to HUD. That mixed race category can invisibilize communities. And so we're working with Chief Seattle Club on how we can improve on this and also make sure that we're seating in the correct locations for the population that they serve. Our families with children were also underrepresented. This is the part, Ruby, I was talking about a moment ago of a potential not physical hub. We are going to pilot in this one a phone-based, or a small portion of this that's going to be phone-based, and specifically going to be partnering with Mary's Place with their family intake line. So it's a phone call that people are already calling into. We're figuring out the methodology of how exactly this will work, but we're working very closely with Mary's Place to make sure that we better capture families with children. We also knew, and this was partially a time thing, or a lot a time thing, but that we under-communicated about this new methodology. That's one of the main reasons I'm here today, and we'll be back with you all many times, is to let folks know as we continue developing and refining this plan, where we're headed, when we're headed, all of that kind of stuff to keep folks up to date. That includes this board, it includes our implementation board and other community partners. Working with our comms team, just so folks know about getting some a clearer place on our website so that anybody can go to see what updates are happening with it as we develop, because as you can see, this is, and what Marvin said, this is not fully baked yet. We have not identified some of the key pieces like hubs, and as we do that, we want to keep people up to date. Christina, I see your hand again.
What about working with the McKinney-Vento staff across the county? Would that not be more inclusive?
Are you talking about the McKinney-Vento staff that work at schools?
Yes.
So this suggestion came up, or I heard that this may have come up at the System Performance Committee meeting yesterday. Those are a group that we absolutely do need to talk to. But there's, with researching like this, we can't be in schools or near schools for a recruitment strategy. That would not pass an institutional review board, and is you have to get some very specific exemptions to be able to research.
Yeah, no, I got it. I'm researching at college. Thank you. You explained it perfectly. Thanks.
Thanks. But I think that's a really good idea to engage with them to figure out where to seed on that. Christina, you and I really, I think, should have a little bit of a sit down and planning session. Would you be open to
and
that?
another question,
Yeah.
is KCRHA not going to continue with that event at the place where they play football, where it was like a health fair, and we're talking, it was like, I think was before COVID, before we did it, maybe you guys could correct me, but there was a once a year health event for homeless individuals, and a lot of families actually showed up at that too. And it was at where they play football. I remember that much.
I don't remember the name of what it is. I know the event you're talking about, and I believe Healthcare for the Homeless Network was the one who is largely facilitating that. But
nope, we're not. I'm there right now, and we did not. No, it was not us.
Because it was not the COC doing that before. Marvin, do you have
but
an
I
idea?
was thinking it'd be I think it was
The
just
event
the city and the
itself-
county putting it on, right, Marvin?
The event itself was a combined event, a lot of different places, a lot of different organizations, City of Seattle, King County, all got together to create that resource fair once a year. It both too had the same design as bringing numerous groups together for an event that helped folks and allowed the system to see how different parts were working. They never did it beyond the one location at Memorial Field. However, at one time, the plan was to do it in different areas of the county, and that never quite panned out. But I don't want to miss Ruby. Did you have a question?
Yes, yes, I do. Thank you, Marvin. Quickly, just want to advocate that as somebody that was homeless in White Center and somebody that took a bus by the church in Burien yesterday, or I guess it's technically in Tukwila, SeaTac area on Military Road. We need to have a hub somewhere near there. 100 and like I don't know how I could stress that enough. I've known personally in the community there's been people experiencing homelessness for longer than 5 years, for almost a decade in White Center alone. So I just need to, as somebody that was homeless there, advocate for that area really, really hard. Burien's very close to White Center. If we can somehow figure that out. We know that we are also having camping vans in Burien, so maybe there wouldn't be as many there, but I saw at least like over 100 tents at this church that usually only has about 20 to 30. So just throwing that out there. Thank you guys for doing this work. I know it's difficult to figure out all the nuances, so I really appreciate the work you're doing.
No, Ruby, I really appreciate that insight. It's not what I'm here to talk about, but I do know that quite a bit is going on in that community right now that needs to be addressed in some other ways as well.
And I did note that when we're talking hubs, to bring that up. We will carry that forward.
Thank you. I think one of the things that you did mention, it's not on these lessons learned, but is a good lesson learned, is that we're need to do a better job of engaging with folks living in vehicles. And so we're working on collaborating with the vehicle residency working group in order to figure out a better strategy related to that. And there's other populations and other pieces that are lessons learned that aren't represented here as well. And I also heard additional lessons learned in this that Marvin, thank you for taking some of those notes. I wrote a couple down myself to make sure that we capture and are improving. This last little lesson learned though is that we, in 2022, we paired the counting part for the PIT with this qualitative data collection, and mixing those two pieces together was a lot, and we won't be doing that again. It required significant logistics. It required more training than what we actually had capacity to fully provide everybody. And we pulled something off that was amazing, but it was far from perfect. And so instead of continuing to have those two pieces together, we are completely disentangling them and really focusing on the data that is necessary for the point in time count. Just want to be really clear with folks that we are not doing qualitative data collection in the same way this year. Okay, a bit on timeline. It's a very high level timeline. We're in October. So you can see that we're continuing planning. We're working with UW to get more information on their learnings from 2023 when they were improving on this methodology. We're working on identifying hubs. Those probably will not be finalized in October, and encourage additional input on where some of those locations might be. And we're working on finalizing our budget on this as well. One of the pieces I will just note on the budget component is a large part of this goes to incentives for people who are part of the count themselves, people who come and get surveys. One of the key things that we've learned from UW so far is they had a slightly different incentive strategy for people to participate that ended up getting to deeper penetration into networks. That was something that we're learning from, trying to figure out how to do, but a summary of it is that when people come, they give their survey to us, we provide them with a gift card. What they then did is that because they track things in real time, the codes of how people were connected, what they were able to do then is say, hey, for every one of the people that you give a coupon to who comes and gets interviewed, you will get an additional $5. And so it was a way to encourage folks not just to come and participate themselves, but it also provided some incentive to get deeper into networks and increase that, and also make it so that people were getting some money through that. So we're figuring out how we might be able to do that from what they did, but it was a pretty smart way to get to deeper network penetration. Moving into November, we'll be finalizing our methodology and staffing plan. We'll of course submit that full plan to the advisory board. There's a couple other folks that we'll be submitting it to as well, but you are ones that I want to get it to first. And we'll be doing volunteer recruitment. So once we get that staffing plan, we'll be able to identify how many people at what locations we will need for recruitment. December is really going to be, is not on here. It's really about getting all the logistics together though. In January of 2024, can't believe we're talking 2024. But in January of 2024, we'll finalize all of the logistics and supplies. And then we'll make sure that we have completed training with folks by the 12th of January is our current plan. So that between the 12th and the 22nd, we can answer any questions, make sure that people have what they need, so that we can be in the field doing data collection from January 22nd to February 2nd. So it's a 2-week period that we would be collecting information. In February, we will take a short break to catch our breaths, and then we'll jump right into the data validation and analysis. That is something, again, we'll do in deep partnership with our partners from the University of Washington, and comparing against validated counts from our sheltered count as well. Our hope right now is to have the data analysis complete by March 15th, giving us some time before getting to HUD's anticipated submission time of April 30th. That my recollection is that does not actually, the submission day does not actually get announced for a bit of time. Sweet, thank you. Would love to open up for any additional questions folks have.
May I start?
Absolutely.
If anyone on the board, my one question that I've had that now through a couple of iterations and working with you is how are we building in interest that will come after the coupons? You hand out 3 coupons and 7 people show up, because people don't travel alone. So they bring folks with them. How is that worked into I guess my question is how do we account for those who just show up for interest versus any sort of payment or other things, but do show up?
Totally.
How does that work with?
What we did in 2022, and I need to ask Zach of what they did in 2023, but in 2022, if people came to our hub because they learned about it from somebody, we interviewed them and we started a new seed with them. So we would give them a coupon and a packet of coupons and consider them person 1 within that. What I don't know on this one is with the way that we're doing the couponing and the printing out of the codes, if there is a way for us to say, hey, this person is coming, like if you and I go to one together, you have a coupon and I don't. I came with Marvin, so am I actually going to get technically one of Marvin's coupons? Like I'm coming as part of your network. And so that's what I'm trying to figure out. Can we actualize that? Because what you're saying is real-time network penetration. Is people in community working together. And that is what this is about, is bringing folks together through this. And so we would not be, all of that to say, the plan is not then to turn folks away. The plan is either to create new seeds or figure out how we connect it within that network.
Thank you.
Yeah.
Floor is open for other questions. Christina? Your hand's still
I
up.
do, and this is
Okay.
more of an Owen question. Right now, HCA uses a code, diagnostic as well as a billing code for homelessness. Has anybody thought about pulling that data out or using a researcher to pull that data out to get some numbers as well? Because that'll even bring us more because a lot of individuals, especially the chronic homeless, utilize the ERs, and that data is gathered by ERs. Have you thought of that?
So the work that got us to that 53,000 number used provider one data that had those codes in it. So it was selecting for people who had those. I don't remember. It was provider one. It had ACEs. I'm gonna have to look at it. Let me go back and pull the exact data source on that, but it is a state level approach that they pull information based off of those diagnostic codes as well as some other pieces.
Because
But
it's
that
another
is,
way of adding to our data that, doesn't necessarily require the stipend amount, et cetera. Kind of like pulling the school records on how many homeless kids there are, that kind of thing, and bringing all that data together and using these other non-qualitative measures quantitatively to gather our numbers as well.
yeah. So yes, my dream, Christina, is that we don't actually have to do a point in time count because we've already interacted with everybody experiencing homelessness in a system or another that currently don't talk to each other. So why do we keep going back and doing this thing? We're working towards that direction. And the two pieces you talked about, yes. Oh my God, yes. So I actually, again, this sounds like we need a series of conversations on this. But some of those pieces were in this 53,000 number. Some of them were not. The actual student ones were not. And this is, I'll send the methodology. It's really interesting, but it's based off of something that Commerce has been doing for, I don't know, I think it's been over 10 years now. They call it their snapshot report, or used to call it the supplemental PIT. They do it twice a year, and it's pulling information from administrative data sets that the state has access to, including HMIS, including some healthcare ones, and then looks at, okay, how many people on this day are experiencing homelessness? The thing that's really interesting to me about the supplemental PIT is they're also, like, this 53,000 number isn't over the course of an entire year, but the supplemental PIT focuses in on one particular point in time, similar to the point in time count. And that number is always much larger than what we ever see in the street count or in our shelters. And so it's like, what that tells me is administrative data is the way we need to go. It also, I mean, I could talk about this one for a long time. It requires significant less resources to do because we've already invested those. We don't have to ask people the same question they've been asked in 8 separate administrative data sets, and we can have access to that information more often because it's much easier to get access to. So that is where I want to head. It's like moving towards integrated data. It sounds like you're thinking a lot about this too. So we should be talking. That got me excited and fired up.
I see. Thank you, Owen. Are there any other questions before we shift to our next agenda item? I don't see hands.
Thank you all again for having me to talk about this. You'll be seeing more of me and hearing more of me, hearing more from me over the next few months and beyond.
Thank you.
Thank
Owen.
you. So moving forward, today, next on our agenda is a presentation from Alex Ibrahimi. Is Alex on the call?
I am here.
Alex is here. The floor is yours.
Thank you very much, Co-Chair Futrell. Hi, everyone. My name is Alex Ibrahimi. My pronouns are he and him. I'm the System Performance Manager at the RHA, and for additional context, the System Performance team really focuses in on coordinated entry. So I'm here to briefly give you an update on the Coordinated Entry Committee. As a reminder, we opened up applications for the Coordinated Entry Committee on September 15th, and we held them open until very recently, October 13th. We had a total of 23 applicants to the Coordinated Entry Committee. There was a conversation that took place on Monday with this board's co-chairs to review the applications. Of those applications, 13 were selected to be introductory members of the Coordinated Entry Committee. 6 of them are members of your COC board, so 6 of them are members of this group currently. 7 of them are not currently members of any committee, and I believe, and Alex Piffner, my colleague, can confirm this, that those 7 applicants that are not currently part of the board, their information, particularly their biographies, their brief bios, were sent to this board for review. I just want to confirm that took place and you all had a chance to review them.
Yes, they have been sent to all board members.
Okay, thanks for confirming that, Alex. So in conversations with the co-chairs on Monday, we reviewed applications and confirmed the ones that were representative of the various constituencies that we all are very familiar with in the continuum. I believe that after this brief update, the co-chairs are going to move to take a vote to confirm those members, but I wanted to be here with you all to answer any questions that you may have.
Are there any questions? I am not seeing any, Alex. Could we, what I don't have right in front of me was the board members that what are the 6 board members? And I believe everybody has a copy of bios for the 7 folks joining the board from outside of our board work. So the 6 board members, just so folks, if they're here, they can speak. If not, yeah.
Yep. In no particular order, first one is Ruby Romero, Patricia Barnes, Antoinette Lambert, Shaja Floyd, Kenyatta Carol Hillman, and Sherry Tillman.
I beg your pardon. I was not approved.
I would like to say that I actually could step down from that position because I don't actually think I can still participate in that and be able to spread my time wisely. So I would like to actually, I appreciate it, but I think that it's in the right decision for me to step from that position, if that's the right place to do that is right now. Thank you.
Okay, so let me take them in the order I received them. The first question was, Galena said she not being accepted. It was not due to ability or interest. It was balancing and getting an odd number. And since there's so much other work that we hope that Galena will help lead us on, that wasn't necessarily something that needed to, that was the hope that Jaja and I had of expanding on and building into the board work. Second, Ruby, if you're stepping back, that will leave a position open. And if the board wants to continue with the vote, it would be possible that if Galena has the time, and she definitely has the interest, we could put forth Galena, because her application was not failed. It was simply trying to balance and use all of our board members in the best way. And I'm sorry that it usually comes out in this fashion, because it's not how it was intended. Kenyatta?
Can you name the members again that were accepted in the program?
I can, yes. So I'm going to substitute Ruby for Galena White. So starting with Galena White, Patricia Barnes, Antoinette Lambert, Shaja Floyd, Kenyatta Carol Hillman, and Sherry Tillman.
Okay,
This one, okay. Ms. Patricia,
Good afternoon, everyone.
good afternoon.
Quick, I heard my name. Are you saying that I am accepted on the board? I'm trying to get,
It hopefully will be part of a vote that we're about to take in just a
Okay.
moment.
okay, I got you. I'm present. I'm here. And this is, okay. I remember the meeting we had. I just need to clarify because you all know, just trying to put things in perspective. This is the,
Coordinated entry.
the
committee.
coordinated entry. There you go, at the meeting. I got you. Thank you. You put my name in. I didn't need to go through the application process with my bio, correct?
We didn't collect a bio from the board members. We hope that everyone knows each other, feel comfortable asking questions if they had concerns. We did get the bios of the folks we don't know, and that
That's
will be coming in and be near our work.
Thank you.
And hopefully building alignment to what we are striving for within our system.
Thank you for clarifying.
Well, I'm going to entertain a motion for accepting of the coordinated entry board and included Galena White replacing Ruby Romero as part of the full-time committee.
Seconded.
Thank you. And that does require a roll call vote. Can everybody hear Alex?
No. Jasha's right here, so she could vote.
Okay. Can you hear me now? Okay.
Yes.
great. Okay, please say approve when I call your vote when I call your name. Patricia Barnes Sam. Do you approve?
Approve.
Tamara Bauman,
Approve.
Kenyatta Carol Hillman,
approve,
Lise Castro,
Approve.
Jaja Floyd.
She's not here.
I know she did tell me she approved of all the
She gave her
members.
vote to Alex, she just told me.
Yeah, I have it. Marvin Futrell,
Approve.
Antoinette Lambert,
Approve.
Dorsal Plants.
It's landing.
Ruby Romero,
Approve.
Martha Sassarosi, Christina Selwicki,
I approve.
Sherry Tillman,
approve,
and Galena White. Here.
Approve.
Amazing, with 11 votes to approve the.
Motion is passed. We now have a coordinated entry committee. First meeting is Alex?
It's the
Because I didn't write
20th.
it down.
It's the 26th. It's next Thursday. I'll be sending out materials to the members shortly. So thank you very much for your time. And I'm looking forward to collaborating with you all that are going to be on the committee.
Thank you. Is
Question,
there? Yes,
Alex, Do you have a time for the meeting
It's
now?
10:30 a.m.
Thank you so much.
You're welcome.
Galena?
Hi, I, first of all, thank you for letting me join the group. And I have kind of a protest to make about the method by where we are asking people to join these committees. Because text submission is often a lot more difficult for different kinds of people. And I believe that it would be more equitable in future to have submissions be in the method that a submitter would like to present themselves, whether that be on live video or over a phone call, or with somebody else present interpreting for them. As an autistic person, I don't present myself well, and people don't tend to hold me in high esteem based on my mannerisms or speech. And I think that I present myself fairly well in text, but I can see that somebody like me might want to present themselves differently. And if we want to make sure that we have a diverse membership to every conference or committee, then I think we should be trying to get a different, a better, more representative way to have these votes and submissions, if you know what I mean. Okay, I'm done.
Thank you, Galena. And I was busy writing while you were speaking because I want to capture that, because I think it's useful for us in the way that we like to work. So.
Board member White, thank you very much for that input and that feedback. And I look forward to having a deeper conversation about how we could integrate that in the CE committee.
Next steps, I'd like to confirm that our next regular meeting. Thank you, Alex. I didn't say thank you. Our next regular meeting is Wednesday, October 1st, November 1st. See, if I don't correct typos, I just go ahead and read. November 1st, 2023, starting at 2. Is there anything else good for the order? All righty. It looks like we're giving some time back to our community. Hope everyone has a great afternoon.
Thank
Thank you,
you.
everybody.
Thank you.
Thanks. Have a good day, y'all.
Yeah, I have nothing. Bye, everyone.
Have
I don't know how to turn it off.
a good
And-
rest of the week.
You too, Patricia.
Good job.